There has been an increase in the development and availability of mobile apps on consumer devices for tracking health and well-being, such as diet, weight, sleep, walking, and exercise apps. Many people have used at least one or more mobile apps to track their health. However, what they decide to use, how long they use the app for, and how the app helps them overall are still considerations that are understudied in the field of personal informatics. Just like how people don't stick to just one social media app or messaging app, most people have multiple health apps that they work into the flow of their daily lives. And much of personal informatics relies on the use of personal data from trackers and life loggers. The data collected by these apps is supposed to display and quantify the data in an easy to understand manner to help the user make changes necessary to optimize their life. And people use and stop using various apps and technologies in their lives to improve health. Moreover, it was found that people were not changing because of technology, rather people were using technology because they wanted to change. And we see that in personal informatics, technologies that are used are accelerometers, location-based tracking, sensor-based systems, pedometers, active engagement, active tracking, and passive tracking. And furthermore, personal informatics is not just about health and well-being. It goes further to encompass personal finance, personal communications, life photography, travel information, diary keeping, and so on and so forth.
There has been a study on those who used or would like to use such mobile applications. Even though this study was done on only 22 people, it showed that people access these applications through several different mediums, including smartphones and even game consoles. The study also revealed that the users are tracking many different activities such as walking, food and drinks they consume, or even sleep. The main takeaway in regards to this week's topic is a documentary and diagnostic styles of tracking these activities. With documentary tracking, people's motivation behind the use wasn't to change any of their lifestyles, but solely to record them. Whereas the motivation for diagnostic tracking was to find the connection between people's lifestyles and problems they're experiencing, such as fatigue. Some results of this study is that people are not going to keep track of activities consistently and suggest these activity trackers to include social aspects as well as guide the users to be able to connect emotionally and have fun while they're interacting with the app.
Self-tracking biometric data collected by wearable and smart devices provide a purely objective look at a person's behavior and state. Thus, they can provide a unique and potentially amazing method of increasing doctors' and caregivers' abilities to perform diagnoses. On top of that, it allows patients to keep track of what they need to do on a daily basis to remain or become healthy. Aaron Anderson, a good example of the positives, was a cancer survivor and explained how self-tracking has helped him control his well-being and health. But the market is expanding. It is only getting more popular with an increase in wearable sales of 27.5% in 2018. But that means that we now more than ever need to look at the potential concerns that come up with such biometric data collection and wearables and smart devices. John Nasta, a critic of such devices, explains his various problems with this biometric data. This focus on the quantified self he seems to take particular interest with, as he finds that people are often reduced to quantifiable numbers that represent someone, and that can often lead to, or it may potentially lead to, doctors and care providers seeing patients as only those numbers without regards for what the person vocalizes, what the patient vocalizes, and what the concerns they may have are. Additionally, Nasta has concerns with the privacy of patients who use these sorts of devices and who has access to that data. His final concern comes from lack of accessibility, since there are many upsides to these devices, and they are particularly expensive and not included in most insurance providers, and by most, I mean likely all. Thus, many people are barred from this potential good. But at the end of the day, Nasta sees the benefit in these devices, and I think it's personally amazing that it's been able to help people like Anderson take control of his health and become more healthy. But it is a good idea to keep that very cautious attitude that Nasta brings while we move forward to attempt to make a better system and better devices.